Here we discuss seizure disorders as yet another set of disorders that affect the brain. Okay, so first we understand what seizure is all about and look at specific types of seizures. Well, what is a seizure? Here you're talking about hyperactive neurons, which certainly generate action potential in a hyper-excited manner, okay? Sudden transient disruption in brain electrical function due to excessive hypersynchronous discharge of cortical neurons, okay? So that is, say, 100 or 1,000 neurons, all of them simultaneously generating an action potential, releasing certain neurochemical locally, you see? So it's suspected that there is some sort of an imbalance among the neurotransmitters. What if an inhibitory neurotransmitter is lacking, you see? That would lead to the excess amount of a stimulatory neurotransmitter. GABA is shown here. Yes, if there is less GABA for whatever reason, then there is too much glutamate, which is an excitatory neurotransmitter. That could be the cause of seizure, you see, seizure is a common type of neurologic disorder, most common type actually. 5% of the population have experienced seizure at some point. Primary cause is unknown. Secondary cause could be one of many. There could be cerebral lesion, meningitis, vascular disease, trauma, hypoglycemia, hyponatremia, hypothermia, or a drug toxicity. Any of those could be behind this. Now we will talk about epilepsy. Epilepsy is one type of seizure disorder. This is a chronic kind. That means this is not just a random seizure, but there would be recurrent seizure activity. So it comes back so often, you see. The name epilepsis in Greek means a laying hold of. It's something to do with a mysterious force of some kind. Causes could be congenital, that means some sort of abnormality at the time of birth, or acquired. Affects about 0.6% of the population, all right? So now let's talk about the 4 stages that epilepsy would have. This is tonic-clonic, that is where you have jerky, contract, relax type of seizure. Okay, prodromal is where mood change prior to. Then aura, symptoms just before attack. Ictal is during the attack, and post-ictal stage. So these are the 4 stages: prodromal, aura, then ictal, and post-ictal. So what happens is there is certain loss of consciousness. So a person going through this seizure will fall down, and then there is contraction, tonic contraction, so stiffening of muscles, and then clonic contractions, twitching and jerking movements of the limbs. So that is typically the sequence that the person with epilepsy would have. Okay, these convulsions are preceded by an aura, dizziness, numbness, visual disturbance. So a sensation that then leads to these convulsions. Okay, as I mentioned before, this is associated with GABA neurotransmitter abnormality. All right, so this is an electrical imbalance, right? Repetitive depolarization, paroxysmal meaning sudden, depolarization shift, increased frequency of action potentials is how the symptoms start. There are many different types of seizures, subtypes you may say: simple seizure, complex seizure, partial seizure, generalized seizure. And then Jacksonian march is how partial seizure could become a generalized seizure. What's the difference between these types? Simple seizure is where no loss of consciousness. Complex seizures is where there is different levels of loss of consciousness. Then partial seizure is where limited number of neurons within one hemisphere only, whereas generalized seizures is where it's spread out, okay, diffuse activation of neurons in both hemispheres. All right. A status epilepticus is a life-threatening condition, okay? Here, what happens is the seizure activity is continuous, or two or more seizures occur without recovery of consciousness between them. So that is a dangerous kind. Okay, another one is absence seizures. These are petit mal seizures, okay? A minor form of seizure consisting of momentary clouding of consciousness and loss of contact with the environment, okay? EEG assesses type and help identify the focus. So EEG is needed, that is recording of brain waves. That's how you detect what type of seizure it is and how to treat. Treatment with anticonvulsant drugs, okay? So one must consider their possible cardiopulmonary effect and interactions with the anesthetic agents. Patients receiving anti-epileptic drugs build resistance to neuromuscular blocking agents and opioids that you use. So those are some things to keep in mind with the patients having seizure disorder. All right, that's the end of this particular chapter, the disorders pertaining to the brain. Thank you.